one of the things that we know is that people are incredibly complex, and they bring all of themselves to an appointment. They bring their mind and their body to that appointment, and really what we're discovering is that when we're able to address multifaceted needs, our outcomes and our chances of success just increase exponentially. Under traditional models of care, we had separate systems. So we had a dentist in one office, a medical doctor in another office, nurses in between that, therapists in another office, and each acting independently and doing the best that they could for the patient. But what we're really finding is that when we're able to link those together in an integrated fashion, so that you have your medical doctor communicating with your oral health provider, communicating when necessary with a therapist or a behavioral health provider, that the patient gets a much more well-rounded, comprehensive result in terms of what we're able to give them, how we're able to relate to one another, how we're able to work together to partner with them around their health care. One of the interesting things I find is that when you talk about this with people, is it just sounds like common sense, and in a lot of ways it really is, but it's not how our systems have been set up. There are a lot of barriers and things that have stood in the way of this happening. There have been battles over turf. There's been battles between different disciplines of we've always done it this way. Interestingly, our fee schedules and structures aren't set up to handle this. The insurance companies don't know what to do with this type of care. They're not designed to do this. They're more locked into a more fee-for-service model, and what we're talking is a more comprehensive model that is more focused on outcomes than appointments. And so the Learning Collaborative really has just been a place where all of these things can come together, where we can explore solutions, where we can look at the barriers. The thing that I've appreciated is this group is made up of people who are passionate about making change. And so people here aren't willing to just to be and live with the status quo, but are excited about what might be and what could be.